Good evening, I'm Chinling, and you're watching CTV News. Today's breaking news reports the increasing concerns regarding the negative effects of amphetamines as an ADHD treatment on sleep. Attention deficit hyperactivity disorder, or commonly known as ADHD, is one of the most common neurodevelopmental disorders in Canada, affecting 4 to 6% of adults and 5 to 7% of children. Symptoms of ADHD include inattention, hyperactivity, and impulsivity. When left untreated in children, ADHD can lead to poor self-esteem and social function. For many of these patients, stimulant medications such as amphetamines are prescribed to control these symptoms. Amphetamine is FDA approved as a first-line agent for ADHD in adults and children 6 years of age and older. However, the stimulant drug can also keep these patients from getting the sleep that they need. New research shows that the prevalence of sleep disturbances in individuals with ADHD is reported to be in the range of 25 to 55%. Maya Bamber is one of them. The 12-year-old has a prescription to treat her ADHD, and while she never used to have difficulties falling asleep at night, that is no longer the case. For further details, here is a video of Maya talking with her family physician, Dr. Coulter.
Hi Maya, how are you feeling today?
Not great. I'm feeling pretty sleepy.
That's not good. I'm glad we're having a check-in appointment after last week. Adderall can have a lot of side effects, so it's important that we check in.
Okay, that's good. I've been feeling very off lately.
What kind of symptoms are you experiencing?
Recently, I've been having a lot of trouble sleeping, and I can't fall asleep until super late.
That sounds really exhausting. Stimulant medications like Adderall can disrupt your regular sleep cycle. This is normally a result of not having the right dosage or not taking your medication quite at the right time. Adderall can make you feel really alert and make it harder for your body to wind down at night. What are the specific areas of sleep that you are having difficulty with?
Well, I feel tired all the time. And the worst part is, I can't even sleep in to make up for lost sleep, because I wake up super early no matter what.
Waking up early and not being able to fall back asleep can be a really common experience for people taking medication like Adderall. The medication can disrupt your natural sleep cycle, so instead of having a long uninterrupted sleep, your sleep becomes shorter and lighter. This of course makes it difficult for you to get restful and deep sleep. Do you only have a hard time falling asleep?
Well, apart from being unable to fall asleep and waking up super early in the morning, I wake up multiple times throughout the night, and then I have to take naps during the day to make up for lost sleep.
This makes a lot of sense, Maya. Adderall can occasionally lead to issues where you wake up multiple times in the night, which is called sleep fragmentation, which you have been experiencing. This can be very challenging and exhausting because it disrupts your sleep quality. Taking naps can help a little bit, but it can sometimes also disrupt your regular sleep cycle, which can make it more difficult for you to fall asleep at night. It is important for us to discuss some options about how to make you feel better.
My mom also thinks it's because of my Adderall prescription, but whenever I stop taking my medication, I'm so sleepy, so I have to take it so I can go to school and soccer practice.
So sleepiness after taking Adderall can be a sign of withdrawal, so it is always recommended for you to not stop taking your medication, as this can cause more disruptions in your sleep. Since you are experiencing something called stimulant-dependent sleep disorder, which means your sleep disruption is linked to the effects of your medication, my first suggestion would be to start taking melatonin, which is a natural supplement that assists with sleep onset.
Well, I guess I can try melatonin. Stimulant-dependent sleep disorder sounds super scary. Do you think it will really help me? What if I don't want to take melatonin? My mom feels really uncomfortable with me taking a lot of prescription medications.
So this is not a prescription medication, and we would start you on a really low dose to see if it helps and monitor how your body adjusts and if your sleep-related side effects lessen. Amphetamines' sleep side effects can sometimes go away with sustained use, so I know that stimulant-dependent disorder can sound really scary, but I promise you there is nothing to worry about, and this is only caused by your medication, which can be fixed. If you do not feel comfortable taking more medication, we can also look into adjusting your dose of medication and also when you are taking the medication during the day.
Well, I guess since melatonin isn't a prescribed medication, I'm willing to give it a try. Hopefully my side effects will go away anyways if I keep taking my Adderall prescription. In the meanwhile, this seems like a good solution.
Perfect. So let's start you on 5 milligrams of melatonin at night to see if this helps with your sleep disruption. And let's make another appointment next week.
Amazing. Thank you, Dr. Coulter.
I hope that video gave some insight on the issue. Sleep deprivation in children can cause detrimental problems during their period of development and into the future, negatively impacting their physical health, neurocognition, and brain development, with emotional and behavioral outcomes. We have Maya's mother here with us today to share with us how the side effects of her ADHD medications have impacted their daily lives. Hi, Ellie.
Hi, I'm Elahe and I'm Maya's mom. Before my daughter started taking amphetamines for her ADHD, she was forgetful and a little scattered, but she was calm and stable. And I was against the idea of medication at first, and I wanted to try non-drug approaches, but we eventually went forward with the medication. When she started the medication, she seemed more awake and focused. But within a few months, her sleep started to change. She stayed up later, she was unable to settle, and she also noticed that she was becoming more irritable and easily stressed. She was constantly anxious and seemed on edge all the time. She also told me about the nightmares that she had, and I could see that she was exhausted. Our conversations also become difficult. She would snap over small things and her patience was just gone. It was also harder for her to manage her emotions and stress, and eventually she decided to start trying other approaches like taking melatonin, and now she's working really hard to rebuild herself.
Thank you, Ellie. Now we have Dr. Wang, neuroscientist at the Montreal Neurological Institute Hospital at McGill, to share his knowledge regarding the issue. Hi, Dr. Wang. Thanks for coming in today.
Hello, Chinling. Thank you for having me today.
Can you describe for us how amphetamines impact sleep in individuals with ADHD?
Sure, I'd be more than happy to. Some common amphetamines used to treat ADHD are amphetamine, lisdexamfetamine, and dextroamphetamine. However, you may know these more by their common prescription names, which are Vyvanse, Dexedrine, and Adderall. Amphetamines are central nervous system stimulants. This means they increase arousal and nervous system activity through upregulating neuromodulators such as norepinephrine and dopamine. However, amphetamines may cause insomnia, delayed sleep onset latency of greater than 30 minutes, and decreased total amount of time spent during sleep and REM sleep. Amphetamine use may also cause a condition called delayed sleep phase syndrome, which is where an individual's circadian rhythm is misaligned with the cycles of light. This condition is more prevalent in adolescence, and it involves delayed sleep and wake times. Let's specifically talk about dextroamphetamine, which is the active ingredient found in Dexedrine and Adderall. Dextroamphetamine is involved in delayed sleep onset latency and delayed REM sleep onset latency. In regards to recovery sleep, it increases the amount of time spent during stage 1 and stage 2 of sleep. It also increases the duration and frequency of movements during non-REM sleep while decreasing the amount of time spent during REM sleep. In regards to amphetamine use in general, during the first night of recovery sleep following sleep deprivation, it has been found that there is an increased amount of slow wave sleep. However, researchers believe that this is more so because of the increase in body temperature associated with amphetamine use. Unfortunately, there have been conflicting results. For example, research on lisdexamfetamine have found that it actually helps individuals with ADHD stay awake while increasing the amount of enthusiasm that individuals have for performing tasks during the day. It also does not affect the sleep quality, sleep onset latency, or sleep duration in these individuals. As a result of these conflicting data, I believe more research needs to be done on the complex relationship between sleep, ADHD, and amphetamine use.
What would you suggest individuals who are taking ADHD medications do to improve their sleep?
CBT and melatonin. CBT, or cognitive behavioral therapy, helps an individual modify their thinking and behavior to treat insomnia, decrease sleep onset time, and improve sleep quality. However, it takes weeks of commitment to complete. On the other hand, melatonin is a natural hormone secreted by the human body that can be used and taken in supplements. It helps reduce sleep onset time, and it can be used to treat insomnia, which is a common symptom of amphetamine treatments. It's quick, natural, and safe to use. However, it may cause headaches. It may also not be the best option for everyone, so make sure to first consult with your physician before taking it.
Thank you, Dr. Wang. In summary, sleep difficulties are a scientifically proven side effect of ADHD stimulant medications. However, research also shows many solutions to improve sleep conditions when taking amphetamines, and ADHD symptoms can still be treated. Thank you for tuning into CTV News. I'm Chinling, and have a good night.